am Dr. DrMahimaBakshi, and as promised, I'm here with my show Birthing Naturally to bring you the best and the latest in mother and child health. My today's episode is with a very special guest, in fact even moreover special because she's one of my favorite, Professor Alka Kriplani, Head of Department Obs and Gynae, All India Institute of Medical Sciences, New Delhi. She's also a Padma Shri awardee and has also received the BC Roy Award. She has received various other recognitions from various associations like IMA, DMA and many more. She is one of the best clinicians in our country and her expertise is in minimally invasive laparoscopic surgeries. So let's meet Professor Alka Kriplani. Thank you so much, ma'am, for being my guest for the first episode. My first question is, how frequently do you see patients coming to you with unplanned pregnancies?
You will be surprised to know it's quite common. You know, they don't use contraception properly, they become pregnant and then they think, okay, this is God's wish, so let us produce it.
Ma'am, what about teenage pregnancies? How commonly do you see them and what do you think are the consequences of these teenage pregnancies later on in their life when they actually want to plan a baby?
This is a very important issue. Teenage pregnancies are quite common and the reason being they are of two types. One, when there is early marriage and then they become pregnant in the ambit of marriage, but the bigger issue is now sexual maturity is coming up early. We have changing societal conditions and we are not preparing our teenagers for proper contraception and the knowledge of sex education is lacking. That is the reason number of teenage pregnancies are coming for abortions.
Do you feel schools should take more initiative in promoting sexual education?
This is a very, very important point. Schools, everybody should educate youngsters. See, we are having that ostrich theory. We are not talking, sex is a taboo. And on the other hand, they are becoming pregnant, sexual activity is rampant amongst youngsters. So we have to prepare them so that at least their health, they do not suffer.
According to you, what is the latest in birth control and especially for women after delivery, what do you think is the best contraception method for them?
It is very difficult to say what is best. See, what we follow is a cafeteria approach. We have so many options for people with different mindset, with different age, different liking, or what we say contraindications, or which some people are best suited for some. So, commonly available are, for men it is condom, for female either it is hormonal oral pills, non-hormonal pills also, and then they have intrauterine devices. Commonly we call it copper T, but nowadays we have with hormone. So it has other added advantages, or some of the disadvantages of copper T are not there. It is called levonorgestrel IUD, in which there is progesterone hormone, so that is available. So apart from taking oral and injectable, we have then injections, monthly injections. We have recently we are going to have implants, and for females we have female condom also. So all these are available, but after delivery usually one doesn't feel like giving hormones, and it is a very good way to put an intrauterine device because it is long term, it is good for spacing. Another is, even in our Government of India program is bringing injection, that is a 3 monthly injection. You just go to the doctor, take one injection, you are safe for 3 months. So that is called DMPA injection, Depo-Provera. It is also a very popular way.
Ma'am, in earlier days, like when women were on exclusive breastfeeding, even that used to be a method of contraception. But now, when women are not breastfeeding that frequently and using bottle feeding more often, but they still feel that post delivery I might not get pregnant. What is your opinion on that?
She should never take it granted that she is breastfeeding, she will not conceive. That is called skip ovulation. So, breastfeeding is not 100% surety. Even if they are feeding, they should use some good contraceptive method. And if they are not, then they have the same chance as in any other lady. And we should not prescribe drugs which affect with milk production.
Ma'am, what's your advice to women who undergo MTP?
MTP previously we were doing with surgical methods. Nowadays it has become medical. You take some medicines and they abort. Whatever method is adopted, it is very, very important that due precautions are taken so that they do not become pregnant again and they do not come again and again. It is happening in our practice. We see many times they come for 2, 3, 4 MTPs. See, every pregnancy, it has, if you abort, there are some inherent risks. So one should not take it lightly. Plan it properly and use contraceptives properly so that you don't end up in a situation where you have to terminate pregnancy. Apart from being harmful to your body, it is also important. It affects psyche. In many societies it is banned, and let me tell you, it leads to a lot of emotional trauma also.
And what is the latest number of weeks by which a woman can actually get her MTP done? Any change in the law recently?
Not yet. We are trying. Actually, it is called first trimester and second trimester. Up to 12 weeks, it's easy. 12 to 20 weeks there are, because it is advanced pregnancy, so certain definite reasons are an indication. But what happens sometimes, malformations in the baby are detected little late. We are trying a lot. I was president of Foxy, and we are trying with the government and the responsible agencies that this limit in for this indication, because some malformations in the baby may get detected late, and then parents panicky, nobody want to have a malformed baby. So that is the reason it should be increased, maybe 4 weeks extra, so that for those indications for malformed baby, one should be allowed to have little later. In many countries limit is higher.
Ma'am, what's your advice to women who try self-abortion at home by buying over-the-counter pills?
Mahima, this is a very good question you have asked me. Over the years, especially since medical abortion pills have become available, time to time we see patients are self-medicating 2, 3, 4, 5 times. And I have seen patients where it was ectopic pregnancy and they took medicines. She came in emergency in such a serious condition, and then they bleed a lot. So without doctor supervision, it is not at all a good idea. It is playing with your life. So they should always come to the doctor. We should exclude all the possibilities. We should see her health. And of course, we always say that we should hammer on and give them post-abortion advice so that they do not land up again in unwanted pregnancy. So coming to doctor is very, very important.
Ma'am, what's your advice to men on family planning?
It's very, very important, and I would say it's a very neglected issue. As every responsibility in our society is put on to the female, the responsibility of contraception is totally considered as female's responsibility. For pregnancy, two people are important, men and female. But since female becomes pregnant, men are totally, I would say, they are not taking responsibility as much as they should. And why only contraception? All these men should take responsibility of rearing up children, helping in household work. We are bringing up our daughters with the modern thinking that they should be working girls, they should drive, they should be independent. We are not preparing our boys. They are reared up like their mothers are bringing them up. No household work practice. We are not telling them what is their responsibility towards females in the society. I think the time has come, and it is an emergency situation. We have to prepare. All mothers who are listening should prepare their boys from the very beginning to take care of and share the responsibilities of household, of every aspect of life. It is being neglected. So contraception is no excuse or exception, and they should take equal responsibility for contraception.
Ma'am, thank you so much for sparing out time for this interview.
This is a very important subject. I know MahimaBakshi for a number of years, such a beautiful hard-working girl, and she is doing excellent work in an area which is need of the day. See, we are being accused of very high cesarean rates. We have to do introspection, because something which is natural, nothing to compare with that. So to increase the number of vaginal deliveries, we have to make our patients comfortable, we have to prepare our patients for natural birth, we have to give them painless birth, we have to teach them exercises in the antenatal period, so that more and more of our patients, they'll end up in normal deliveries and they enjoy the benefit of normal delivery. So I recommend go through this book, Birthing Naturally. So all the aspects are taken care. You know, it is all mental makeup. If they are prepared mentally that they will deliver vaginally, lot more will deliver vaginally. I wish you all the best, Mahima.
Thank you so much, ma'am.